All right, so I guess it's time. So let me just start by saying thank you all for attending, and thank you panelists for being here. This is a panel that's hosted by the Union for Radical Political Economics, and we have 4 papers and presentations on racialized and gendered impacts of COVID-19. The plan is to have about 18 to 20 minutes per paper, and then we'll have a couple of minutes for discussants and questions from the panel, and then we'll open up for audience questions. So our first presenter is going to be Jana van der Meulen-Rogers from Rutgers, and she's presenting a paper that is called COVID-19 and Employment Losses for the Disabled, an Intersectional Approach, that has co-authors Lisa Schur and Doug Cruz, also from Rutgers. Why don't you go ahead, Jana?
Okay, thank you. Thank you, Jen, and thank you for organizing this. Let me do a slideshow from the beginning. Okay, as Jen just said, this is a paper that is co-authored with my colleagues at Rutgers, Lisa Schur and Doug Cruz, and I do see that they are in the participants, so a shout out to Lisa and Doug. And we are looking at the impact on employment of COVID-19, looking at workers with and without disabilities and taking an intersectional approach. So we all know that there's been catastrophic losses due to COVID-19, and more research is coming out that these losses have not been felt equally, and people who are disproportionately experiencing losses are minority groups, women, and low-income groups. Now, looking particularly at people with disabilities, even before this pandemic hit, we've seen large employment gaps. Roughly, on average, 3/4 of the US population, the non-disabled population, is employed compared to less than 1 in 3 disabled workers. This was getting better, this gap, up through 2015. The gap increased up to 2015, and then it started to close after 2015. We'll see that shortly in one of the slides. And it seems now like the pandemic has erased a lot of this progress made since 2015. So what we wanted to do is use US data from the CPS to compare employment trends for people with and without disabilities during the pandemic. And we also compare these losses and trends before the pandemic. And we are mostly interested in people with disabilities, but then we do a closer look at people with multiple identities by disability and or race, ethnicity, and or gender. And we do both a descriptive analysis as well as a decomposition analysis to look at the explained and the unexplained portion of the employment gap, similar to the Oaxaca decomposition procedure that many of us know. So our paper does have a background section, and one of the main points is that people with disabilities are far less likely to be employed. And one of the main reasons is education and skill gaps. Individuals with disabilities do on average have lower educational attainment, which would translate into fewer skills that are demanded in the labor market. But another big problem is employer attitudes and the culture in the workplace. There is some interesting research, I think that's largely inconclusive, about whether disability income from the government serves as a disincentive to be employed. I think the jury is out on that literature, but that is a possible third reason for the lower employment rates for people with disabilities. Not only are there employment gaps, there's also pay gaps for people with disabilities. And there's differences in the kinds of work that people with disabilities have. They're more likely to be in contingent work, in gig work, where there's lower pay and fewer benefits, and in terms of occupations, more likely to be in blue collar kind of occupations and service occupations, which we know that we've been hearing about and are doing our research on. These are exactly the kinds of jobs that were hard hit by COVID-19. And other background purposes, other literature has shown that the experience of being disabled does vary by gender and by race. So we do use the current population survey, which has a set of 6 questions on disability. And here you can see the 6 kind of questions that there are related to hearing, vision, cognitive disability, mobility impairments, and then 2 questions around the difficulty of mobility. One is the difficulty in performing self-care and the difficulty in going outside alone. And these are considered more severe kinds of disabilities that would, by and large, prevent or make very difficult for somebody to go out and, let's say, go to doctors or go out and do a job. The 2020 data so far have not been seasonally adjusted when it comes to the data on the disabled. And we did our own seasonal adjustments, and then we weighted the data accordingly. So as I mentioned, first, we do a descriptive analysis looking at annual trends in employment and the number of jobs. And then after that, we also look at monthly patterns during 2020, especially focusing in on April, that key month when employment rates dropped so drastically. And after the descriptive analysis, we ran a number of logit regressions looking at the likelihood of being employed by disability status. And then we also looked at gender and race and did the intersection of those, controlling for a number of other demographic characteristics. And the final part of our methodology was the employment gap decomposition, very similar to the Oaxaca blinder decomposition, which has been done many, many times for wages. Fairly did 2 studies about 20 years ago, doing a very similar kind of process applied to whether or not somebody is employed or not. Similarly to Oaxaca blinder, you need to choose a set of coefficients to represent what are the returns to skills in the absence of discrimination, and we use the coefficients from the pooled regressions. And as in the Oaxaca blinder, the residual employment gap is the difference between what is the actual employment rate and the predicted employment rate. And some people do also call that the unexplained gap, and some view it as an indication of discrimination, but it's not necessarily equal to discrimination. It really is the unexplained gap, some of which could be discrimination. Here you see our other controls that are in the CPS, and they include controls for occupation and industry. You may wonder, well, if you're looking at people who are not employed, why would there be an occupation or an industry? The CPS does ask people, if you were employed in the past year, what was your occupation or industry? So we have a subsample of people who are not employed now, but were employed in the past year, for whom we have information on occupation and industry. So in terms of sample means, briefly, they are quite comparable for people who are non-disabled and disabled, except, as you'll see in just a moment, employment status, age, education, and marital status. People with disabilities are quite a bit less likely to be employed or to have college degrees or graduate degrees. They are also on average older, and they're considerably more likely to be separated or divorced or widowed. And when I saw those numbers, I looked in Scholar Google, and there is quite a bit of literature looking at the interplay between disability, divorce, and also employment. So that's an important and interesting literature there. And in terms of the occupation industry distribution, people with disabilities are underrepresented in white-collar occupations. So we can see in managerial jobs, about 12% of non-disabled workers hold managerial jobs compared to a little under 9% of disabled workers. So here's just the sample means showing what I was just mentioning. And I think of particular note is the top row. The employment rate for non-disabled is 72% compared to 29.5% for disabled. And going all the way down, you can see the considerably higher rates of separation, divorce, and widowhood for people with disabilities compared to without. And the differences in education are also clear. All right, so let me turn next to our descriptive statistics, and we will look at annual employment rates, the number of jobs during 2020 each month, and then additional data that are in the paper but not in my slides show that the workers who have disabilities are indeed more prevalent in those occupations and industries that had larger overall declines during the pandemic. So these are employment rates for each group, non-disabled and disabled, relative to what their employment rate was in 2008. So the blue line is people with no disabilities, and orange people with disabilities. So this is looking at each group's employment rate relative to 2008. So hence that would start at 1, it's an index. And you could see the growing employment gap up through 2014 and the progress given really strong economies in the last 5 years. And then all of a sudden a huge decline again for both groups in 2020. So looking now more closely at the year, which thank goodness has finally ended as of 3 days ago, for 2020, we did look at data going through September. And again, blue is people without disabilities and orange people with disabilities. And this is the number of jobs. Again, it's an index, so this is indexed to January. And you can see the larger relative decline for people with disabilities in the number of jobs. And the bottom figure shows the types of disabilities. And we can see the most drastic declines for those 2 kinds of disabilities that I said were an indication of being more severe. And those are self-care and going outside impediments. These folks generally experience bigger declines in the number of jobs. And finally, the top graph here looks at patterns by gender, and the bottom graph looks at patterns by race. And we can see that in general, women with disabilities had stronger declines in the number of jobs compared to the other categories, all men and women with no disabilities. And similarly, Black people with disabilities had bigger employment declines compared to the other groups, all white people and Black people with no disabilities. All right, we did a number of regressions looking at the likelihood of being employed. And we found that people who are disabled were, that disability gap was statistically significant and different from 0 in both of the 2 time periods that we looked at data for, January through April and January through September. And also we saw larger employment declines, or the likelihood of being employed, for women compared to men, and for Blacks and Hispanics compared to white non-Hispanics. When we added a two-way interaction term, we saw that disability and gender interacted, as well as disability and race were statistically significant, implying that these people in these categories had larger employment declines compared to white men with no disabilities. And similarly, for three-way interaction, white and Black women with disabilities had relatively stronger likelihood of not being employed or employment losses during the pandemic. And this is an example from a longer table in the paper looking at the three-way interactions. So paying particular attention, close attention, these are additional gaps added on to the employment change for white men during the pandemic, which was already negative. So you can see for statistically significant declines, they are for white non-Hispanic women, Black non-Hispanic women in January through April. And again, for the whole period, January through September, white non-Hispanic women who are disabled had stronger employment gaps or job losses. The last thing we did, and then I'll close, was the decomposition. And we saw that in 2020, very little of the employment gap is explained by observable characteristics. Only 8% of the gap in the first couple of months, and then about 18% between April and September. And if we look at the change in the gap going from this first to the second period, we see about half of the increase in the gap is explained by observable characteristics. We did a similar analysis comparing 2020 with the earlier years and made a similar conclusion. So here, I think the most interesting row is the very, very bottom row, which highlights what I had just said. From January through March in 2020, about 8% of the employment gap is explained. It's explained 18% in the second period, and the change between the two periods, a little less than half of the change is explained by productivity characteristics. And among those explained characteristics, occupation and industry to some extent, but largely occupation explains the most of the employment gap between people with and without disabilities. So our conclusion is that our analysis, our intersectional analysis, is showing that white and Black women with disabilities had relatively larger employment losses during the pandemic compared to white men without disabilities. And the decomposition results, again, in summary, is that we do have a substantial gap in employment by disability status, even after controlling for a bunch of demographic characteristics. And this gap increased in size during the pandemic. A large part of the gap, of the explained gap, is accounted for by industry and occupations, and how the pandemic really hit different occupations in a different way. However, we still see an increase in this unexplained part of the disability gap. And in terms of policy implications, and I think we'll be hearing this again and again in today's panel and other panels during the conference, is that it's so important to pay attention to the intersection of disability with gender and race when designing employment policies that will help the most people. And in terms of policies specific to people with disabilities, we really need to do more to provide telecommuting accommodations instead of trying to pigeonhole people who have disabilities into a traditional workspace. And finally, it's super important to make sure that the pay and promotion of people with disabilities really are determined by their job performance and their qualifications, and not by negative workplace dynamics. And that's all I have.
That's great. Thank you, Yana. Next up, we have Tom Masterson from the Levy Institute, who is presenting a paper titled COVID's Early Impact on Job Losses Among African American Women in the US. And the authors on that paper are Michelle Holder, Tom Masterson, and Janelle Jones. Michelle is from the John Jay College of Criminal Justice. Tom Masterson, like I said, is from the Levy Institute, and Janelle Jones is from the Groundwork Collaborative.
Okay, now you should be able to hear me. Okay, yeah, I'm not Michelle Holder, despite what my tag says on my screen here. Yeah, thanks Jen for organizing the panel and for chairing today. What I'm going to do is briefly introduce the paper, give a little bit of the motivation, talk about the data, and then get to the results. Our paper will be slightly less impressive than Yana's, since we kind of stopped at the descriptive, but we looked at something a little different. So first of all, the motivation. So the economic impact of the first wave of the COVID-19 pandemic, of course, is lockdowns and stay-at-home orders, which amounts to a huge demand and employment shock. So no surprise there. And it's very unequally felt. There's a disproportionate impact on people of color, especially Black women in the U.S. Not only about a third of the workforce at the time was able to work from home, and a lot of the occupations and industries where people of color and especially Black women are concentrated are not among those occupations. So it's been said over and over again that the pandemic has kind of laid bare the structural inequalities in the U.S. economy. I just kind of repeat that again. Less likely to be able to work from home, so less likely to have jobs that make that possible. Overrepresented in frontline occupations, especially nursing, and also cashiers at grocery stores, for example. Overrepresented in accommodation and restaurant work, which is arguably the hardest hit industry in the pandemic. So, there's a lot of factors combining to really make the employment shock worse for especially Black women. And we'll see some numbers that bear that out. Now, the unequal impact is felt in two ways: the labor market impact, right, which is disproportionately, disadvantaging Black women, but also health risk, right? So, aside from the direct impact of the pandemic, it affects people with comorbidities, other health conditions more greatly. They're more likely to be to get sick if they're infected. If you're working in a higher risk occupation, you're more likely to be exposed and infected. And if you get sick, you're more likely to be hospitalized. And if you're a Black woman, you're more likely to receive ill treatment in the health system. There's just a number of kind of overlapping and reinforcing factors at play. To just kind of, can't see where I'm at. Okay, so the data we used, the same data that Yana used, although we didn't use 20 years of data, we just used 3 months. And in fact, the paper just covers the changes between February and April. But you know, for just for this panel, I got the data for November, and so we'll see, you know, what's been happening since April for different groups. So it's the CPS basic monthly survey, the labor force survey for the US, carried out by the Census Bureau, the Bureau of Labor Statistics. And we categorize individuals by race and sex. So we have four categories that we're going to look at, but focusing on black women. So black women and men are all those identifying as black only or white and black, but not of Hispanic ethnicity. White women are those identified as white only and not of Hispanic ethnicity, and then there's everybody else. Now, all the usual caveats apply about the racial categorizations, the sex categorizations in these surveys. You know, they are what they are, you know, I like to paraphrase Donald Rumsfeld. You go into analysis with the data you have, not the data you wish you had. So here we are. Okay, so in terms of results, first of all, this is from the April employment situation from the BLS, and it shows, you know, the changes between February and April for individuals aged 20 and up. The other data that I'll show is 15 and up, but you know, if you limit it to you know, 18 to 64 or whatever else, the patterns are pretty much the same. So what you can see is the unemployment rate in February was fairly low overall, 3.5%, 2.8% for white women, but for black women it's 4.8%, and black men it's 5.8%. By April, black women had the highest unemployment rate at 16.4%. And although white women had a larger percentage point increase, there's still, you know, lower percentage, still lower unemployment rate for white women. The labor force participation rate fell by about over 3 percentage points in just 2 months, which is huge, of course. And the drops were largest for black women and men. The employment population ratio, therefore, which is kind of a combination of these two, is below 50% for black women, you know, so dropping by over 11 percentage points, the largest of any of the groups that we're going to look at. So, you know, fairly catastrophic drops in employment across the board. This, I'm sure, comes as no surprise to hear this. But, you know, especially harsh for black women. Okay. And I obscured my thing, and I'm only halfway through. Okay. So, I have given presentations before, swear to God. Okay, so moving on to the data. So these data are from February, and what the particular angle we're looking at is based on Michelle's work on occupational segregation. And so we wanted to look at both industrial and occupational concentration of employment for black women. And you can see that you know, there is a fairly strong concentration of black women's employment in healthcare and social services, 28%, which is more than twice the overall rate, the overall share for all workers. And so black women are actually concentrated by industry more concentrated than other workers. The top 5 industries make up about 2/3 of black female employment in February. And you'll notice kind of conspicuously there are things that will play a big role in terms of employment shocks in the pandemic. Healthcare and social services, more than you'd think. Retail, trade, accommodation, and food services, right? These are going to be hard hit. Okay, so moving on then to look at the change in Black women's employment by industry. So this is the percentage point change between February and April. Good news, everybody. The employment in utilities rose by 26%, but as you can see, utilities is a fairly small amount. So that's a denominator thing happening there. But the biggest drops, of course, are in arts and entertainment, private households, accommodations and food services, and agriculture, forestry, fishing, and hunting, strangely enough. But again, that last is not very large, right? Only 0.4% of Black women's employment in February. But private households, so this is, domestic service, personal care, this kind of stuff is happening, is kind of gone, and accommodations and food services, right? So, but in the health services industry, which is not as hard hit overall in terms of employment, there's only a 15% drop in employment for Black women. A lot of that is in childcare, right? So about 148,000 jobs lost there. And in the health and social services industry itself is 122,000, and then another 26,000 in other industries. Hotels and restaurants are nearly 1/5 of the jobs lost by Black women between February and April. Especially among cashiers, right? So 121,000 in the hotel and accommodation and food services industries, 57,000 in other industries, especially retail, and waiters and waitresses. So wait staff, 137,000 jobs lost between February and April. Right? So that's the industrial look. Now, as it happens, if you kind of look at the places where Black women are concentrated, and white women, by the way, are also the top 5 industries are almost identical for white women, although not as large a share of their employment. But those aren't necessarily all the industries that had the largest drops, right? But if you look at occupation, there's a little bit more correspondence. Looking at occupations, right, the top 5 accounts for more than 53% of Black female employment in February, right? And that's office administrative support, healthcare practitioner and technical, right, sales and related. So especially sales and related are going to see huge drops in employment. So when we move to, I got 3 minutes, I'm doing good. So when we move to the change in share by occupation between February and April, again, in the social sciences, it's been boom time for Black women in those 3 months. But in other places, not so much, right? So personal care and service, again, 60% loss, food prep and serving related, almost half of the jobs lost, again, and building and grounds, this was not a large share of employment. Sales and related, so this is where a lot of the cashier work and other work in non-grocery stores disappears. So that's 40% down, etc. So, what you also see is that another, excuse me, another aspect of the employment shock is that the concentration by occupation actually increases between February and October, February and April for Black women. It's now over 56%, so over about a 3 percentage point increase in the share of employment in the top 5 occupations. Okay. Just wanted to point out that the drop in healthcare services was lower than the overall, right? So this is where I said that the differential impact happens, right? So Black women in frontline occupations didn't lose their jobs, but Black women in other occupations did. So that's the deal. And it's been an unequal recovery since April. So these are the raw numbers for individuals 15 to 85. Employment is obviously down by 32 million between February and April. And, just to take one step back, who categorizes themselves as employed in April is a little bit hazy, right? So it's not quite clear if you're still employed, if your business is shut down. You might, maybe you're hopeful and you think, yeah, I'm still employed. They're going to open right back up. And you say, yeah, I'm employed, but absent. So that category grew quite a bit between February and April. Anyway, the point is that there's been job growth since April. Between April and November, 24 million jobs regained, still 8 million short of where the economy was in February. These are not adjusted seasonally. And the main takeaway from this slide is this, right? So Black women didn't have the largest, had the largest drop. They didn't have the smallest increase between April and November. 20% is greater than the average, right? But overall, between February and November, Black women are down more than any other group, right? Almost 9 percentage points, whereas everybody else is between 4.7 and 5.4% down from their February numbers, right? So in a lot of ways, this has been, much more, the economic shock has been much more difficult for Black women than for other workers. So just quickly, so largest job losses for Black women were in 2 occupations: cashiers, 178,000, and childcare workers, almost 150,000. Black women are concentrated in the healthcare and social services industry. 28% of employed Black women in February. That's twice the overall average share. And there was a 17.4% decline in employment there. In terms of policy implications, these won't be too eye-opening, I guess. Continuing cash assistance and controlling the pandemic are two things that kind of come quickly to mind, right? So having a plan would be great for the vaccine rollout, which apparently is not happening. It's going to take 10 years or something at this rate. I heard an earlier panelist say, I think that was Karina in the last panel. So that's the short term. Hopefully after January 20th, we can kind of shift in this direction. In the longer term, removing healthcare from the private sector. So the opposite of privatization would be good. So publicization or socialization. Let's just go ahead and say that. Federal jobs guarantee, as folks at the Levy and Derek are all in agreement on this. In terms of policy target for the Federal Reserve, full employment should target the Black unemployment rate, not the overall unemployment rate, right? If you remember, the very first table had the overall unemployment rate was about 3%, but it was much higher for Black men and women. So that's it. So thank you very much. I hope I'm not too far over.
Not over at all. Thanks, Tom. That really sets up well some of what I'm going to talk about, which is going to be partly about Black women in nursing. So that's not entirely behaving, but I'm just going to leave it set up like that so that that should be enough of a guide. So I'm going to pick up on some threads that Tom talked about a little bit about Black women in nursing and healthcare, and in the short term, controlling the pandemic. So what I'm going to try and do in a much less organized manner than either Yana or Tom, sorry, is give a little bit of background and then talk about how the concentration of demographics can be understood as reasoning for occupationally based interventions. So this can provide a rationale for occupationally based interventions. For anyone who's not familiar with the phase 1A vaccination plans, were healthcare workers and residents of long-term care facilities. So I'm going to give hopefully a pretty quick background on this, basically the setup of what's happening and how attention has shifted over time. Initially, probably some of you remember when people were talking about flattening the curve, and the main capacity constraint appeared to be the number of beds and the number of ventilators. So I've been arguing that the capacity that we have in terms of healthcare workers and their mental and physical health is a really important constraint. Nurses are the most common healthcare workers that we have. Their physical health and mental health is also a limit to healthcare system capacity. And that works in a couple of ways, which we can come back maybe and talk about a little bit more. Effectively, if healthcare workers get sick, so if we have morbidity, then they increase demand for care and also reduce supply of care. At the same time, if healthcare workers pass away, then that's a sort of permanent reduction in the supply of care, where we would normally think about that as a retirement rate that's replaced by a replacement rate of new graduates, right? So there's an ongoing shortage of nurses. There's going to be a more significant shortage of nurses post-COVID. All of the sort of background of this suggests that it is in states' interests who want to maintain their healthcare systems to do everything that's possible to keep healthcare workers from getting sick. So one of the things about COVID that people have talked about is how it's played this revelatory function. What the revelatory aspect of that is highlighting existing issues, right? Existing issues that were already there. So some of this is based in some field research that I've done in South Africa and work that I'm increasingly doing in the US with nurses here. So basically what I found in this study of sort of precarity and anxiety, but most directly stress, was that among the nurses I spoke to, there were 71 Black women hospital nurses in public hospital who I interviewed, and chronic stress was a basically universal experience. But that stress didn't come from nursing or from nursing alone. It came from the way that nursing interacted with their personal lives. And this is something that some of them described as bad stress. And so here's an interview question that I asked: tell me a little bit about the stress you experience at work and at home. And the nurse responds, what can I say? At work, there's not stress like bad stress. You know, like the bad stress seems to be located in the household. But I would argue that work stress and personal stress are indistinguishable. And this is probably true for most people, but is especially true with the case of nursing, where you have people who are working on 12-hour shifts. You have people who may be single mothers, and you have them trying to grapple with finding childcare for 12 hours at a time. So this places significant stress on women with children who are nurses. And that has the appearance of not necessarily being exactly personal, but as stress that arises in relation to the wage employment that people have. In South Africa, what I found in terms of dependency, so this is people who are depending on nurses' incomes. Dependency was relatively high among nurses, which meant that they were supporting more people, which put other pressure on them. Dependency was relatively high in South Africa as a function of very high open unemployment, especially among the Black population there, as well as morbidity from things like TB and HIV, and mortality, of course, also from HIV. There are there's a good set of reasons to imagine that some of those constraints in nursing extend beyond South Africa, like shift work, for example, and I'll talk about that in a second. But there are also really good reasons to think that, especially during the pandemic, increased dependency is likely something that impacted nurses in the US as well, right? Where we also have had increasing employment, as we have just seen, as well as increases in morbidity from COVID and mortality from COVID also. And so for nurses, they experience that in their paid work, but they also experience that in their families and households and extended households and things as well. So in a pandemic, I would expect these things to be experienced in a more acute way. But here are some characteristics of nursing that are consistent across South Africa and the US and elsewhere. Personal stress is experienced at home, but as a function of work structure. The nursing occupation places a geographic constraint on nurses. It sort of dictates where people can live. The shift schedule is a significant constraint. That impacts whether people have children or whether they have their children living with them. It also shapes the relationships that they have. And when people internalize this as personal stress, what comes out of that is individualized recommendations about coping strategies, and also personal feelings of shame and feeling like these things are personal failures. And there's a culture in nursing of leaving your personal life at home. So there's not much recognition that actually, if these are widely spread across the occupational group, then they really are occupational hazards, which means that occupational interventions might have a good place in this. So far, key points: the health of healthcare workers under any mode of production is foundational for healthcare systems, as well as for societies and communities and families, households. Nurses' health issues didn't start with COVID. There are roots linking gendered and racialized roles in paid work and in unpaid work at the household level that have caused health issues for nurses well ahead of COVID. And the last one is that entire healthcare systems function in spite of the distress that the occupation imposes on people who are in it. And as we heard from Tom, the people who are in it are disproportionately Black women and disproportionately women. So I have the numbers there for South Africa, but I really want to focus on the US work. So the US healthcare sector is disproportionately women. This is the same CPS data, probably maybe a little bit older. But the healthcare sector was 75.4% women. And if you aggregate what the CDC would sort of consider now direct care work, which is really what they mean by healthcare workers or healthcare personnel, it would include nurses and physicians and doctors, and as well as certified nursing assistants, but it would also include home nursing aides, and in some case, it would also include personal care aides. And so if you aggregate together the sort of direct care category, then you come up with this figure that about 18% of the people who are working in there are Black workers. So again, to me, this provides some logic for occupationally oriented interventions, because by going through an occupation, you're able to target groups that you might be concerned about for other good reasons, like equity concerns. Okay, so now is where it gets a little bit complicated, because I want to start talking about a vaccine. My notes are considerably messier than the slide, though. So, okay, so just to start out with, given that logic from above, states should prioritize healthcare workers, right? If the healthcare system depends on healthcare workers and healthcare workers are more likely to be exposed, and we don't want sick healthcare workers that increase the demand for care and decrease the supply of care, it makes sense that healthcare workers would be at the top of the list. So that's just sort of a first point. This chart here, this is the Morbidity and Mortality Weekly Report. This is released by the CDC, but this data comes from a project called COVID-Net, which is a surveillance project. And that project looked at 98 counties in 13 states. Those counties cover 10% of the population of the US. So they cover about 32 million people. So these are some of the more populous counties in the US. But these numbers will be different than the numbers that you will see at a national level otherwise. This is the best data that we have for healthcare workers, hands down, that I have been able to come up with, including the CDC data that I'll talk about in a second. So here you can see from the top line, Black non-Hispanic healthcare workers constitute 52% of healthcare workers who are hospitalized from COVID in this data. Other findings from that study were that 67.4% of healthcare worker hospitalizations were direct care workers, which include things like physicians and respiratory therapists, physiotherapists, dentists, as well as registered nurses and nurse practitioners and CNAs and medical care technicians. And so this wide range of people who do direct care, who directly interact with patients. So over 2/3 of healthcare workers who are hospitalized do direct care. Of the total number of healthcare workers that were hospitalized, 36.3% were in nursing related occupations, were nurses or were nursing related, which is the largest proportion of healthcare workers who have been hospitalized. So then I want to go over and look at the CDC data over here. So in the CDC data, okay, so the asterisk is there for me to remember to tell you that the CDC data is really unevenly reported. There are many, many states that have zero information for healthcare worker status. The entire data set now, I think, covers about 14 million people, and only 20% of it has healthcare worker status recorded. Again, this is some of the best data still that we have available, and so we're still using it. And really what I want to look at here is just this pattern. So women are the vast majority of healthcare workers. They're also the vast majority of healthcare workers with COVID because they tend to be concentrated in more direct care. And in such a case, you would expect that they would have more severe cases of COVID also. And so what you see here is that women are more likely to be hospitalized in the ICU, have acute respiratory distress syndrome, end up on a ventilator, or to pass away. But what's interesting about this pattern here is that if you just look at cases, so this is just cases among women healthcare workers, we have Black women healthcare workers are blue and white women healthcare workers in orange. There's a gap there that is really, really extremely large compared to what you see as the gap sort of here when we're looking at death. So Black women who are healthcare workers are overrepresented in severe COVID cases across the board, in contrast with white women healthcare workers, which seems, again, like this is another good reason to target interventions, because here what we're seeing is that women are doing direct care that's paid, they're doing direct care that's unpaid, they're critical to the functioning of communities and households. Some of their work makes self-isolating difficult or impossible, and they're under significant amounts of stress. So this is a good reason to target interventions towards healthcare workers. But when I started looking at the intervention guidance, I was sort of alarmed to find this is guidance. There are 4 sets of guidance that I was able to find, 4 frameworks, different kinds of frameworks that they're all related though. The World Health Organization, the CDC, which is from the Advisory Committee on Immunization Practices, Johns Hopkins Health Security Group, and the National Academy of Sciences. So there's a lot of documentation, there's a lot of guidance. One of the things that the guidance really agreed on was healthcare workers should be among the first people to get vaccinated. At the same time, in that guidance, most of it emphasized just a couple of points, and across the board, equity was a concern, at least in the abstract. And yet there's this sort of strange thing that there's no acknowledgement that if equity is a concern, then there's some equity progress potentially being made just by looking at healthcare workers to begin with, just by having healthcare workers be the first population because of the concentration of women, especially Black women who are in healthcare. But there's no acknowledgement of that at all. which begs the question as to why. So if interventions seem merited by sector or by occupation, then we might say, well, we could just pattern the intervention on the basis of race directly, where we know that race has a significant impact on severity of COVID, partly because of the occupations that people are in, or we could do this still by occupation. So what happened with the advice is we're focused on a sector, healthcare workers as a sector, healthcare as a sector. We're not looking at occupations, but people aren't spread evenly across occupations by demographics. And so if you look at this, women healthcare workers, they're disproportionately concentrated in lower income, what's perceived to be lower skill, what is perceived to and is accorded lower status, and people who do more direct care. If you look at Black healthcare workers, we see a sort of similar pattern that Black healthcare workers are also concentrated in these sort of lower status, lower pay kinds of jobs. These are also the kinds of jobs where indirect care that they're giving, they are least likely to have access to personal protective equipment because they're not in hospitals. And some of these people are home health care workers and have no access to personal protective equipment at all. So what I found when I'm going through the guidance that's there is that not only is there's no mention of women outside of women who are pregnant. So there's no even attempt to acknowledge that there's some targeting happening, but there's also a real avoidance of it. There's no within sector demographic analysis at all, which would tell you maybe we should focus on some certain occupations, which I mean, you have to wonder why that's not present in any of the advice that's coming out of these. And, you know, the CDC advice obviously has been accepted now. So there's really like a non-acknowledgement of race and gender and citizenship status. I'll give an example about if I have time later. So you have to wonder why this is not present in the recommendations, in the guidelines. And one of the reasons that I think it's not there is because I think the priority ordering such an analysis would dictate, right, what that would entail would say that people who are in those lower income, lower status, perceived lower skill occupations would be prioritized for the vaccine, right? So you would have a situation where, you know, if Black women healthcare workers are disproportionately affected and they're clustered in the lower end of these jobs in this demographic distribution, it would make sense to vaccinate them first, right? So you would have maybe a setup where you would have Black women home health aides at the top of that list. You have the least valorized of jobs that have the least people who have the least access to PPE, who are least able to protect themselves, the least likely to have benefits or health insurance, would be at the top of the list of people to get the vaccines. Also because they circulate among people's households, and if they themselves get sick, then they can spread COVID. So you would have people at the top of the list that would run directly up against the perceived status of different occupations in medicine. So I think that that's a pretty important potential issue. And so, you know, in looking at that, I guess, I think you have to read the silence that's in these frameworks, that's in the guidance, and try and figure out what's actually going on there, what is the grounding for that. So I think it challenges popular ideas about status and the value of work and workers. I think people are also personally invested in, you know, many of the people are in public health and are doctors. I think people are personally invested in the ways that they think that health happens, and that status certainly affects the way that people think about that. So if we followed a distribution principle of harm reduction, we could very easily prioritize people within sectors to get vaccinated according to comorbidities, their actual risk, their risk of exposure. You know, I mean, we have data on these things. This would not be so difficult to do. So integrating data on incidents of extreme morbidity, so people who get the sickest, and mortality would tell us who the priority populations should be. So that challenges the value, the perceived value of jobs, but I also think that really changes the terms of the conversation about the vaccine and about health more generally. And I say that in the sense that it requires a recognition that health is gendered and racialized in the production, in its consumption, in its history, in its knowledge production, and more. That gender and race are really fundamentally integrated in health from, you know, the beginning. I mean, you know, you need only look at experimentation for this. So I think it would shift the conversation in a way that would require recognizing things that maybe the medical establishment is not quite willing to grapple with. I want to talk about the extension of this because this works beyond phase 1A, outside of healthcare, into thinking about essential workers, right? Prioritizing people based on their risk could be done across the board. So I can give an example of that having to do with meat processing and police. Maybe we can come back to in the Q&A. But ultimately, I read this silence from all of these organizations as an implicit endorsement of within sector distribution along lines of existing power relations, rather than taking on directly this very clear pattern that we have of demographics and very clear risk pattern that we have for severe COVID and morbidity, and actually prioritizing the people who are most at risk. So a harm reduction approach certainly seems like a different one than what we're doing. So just to summarize that really quickly, targeting by sector is inadequate. At minimum, we need to target by occupation, but ideally we would be targeting by risk and vulnerability, and we could be. We have the data to do this, but we're not. So I'm gonna stop there and stop sharing my screen. And Derek is up next. Derek is now at the New School. His paper title is A Racially Inclusive Recovery to the COVID-19 Pandemic. At the New School, he is the founding director of the Institute for the Study of Race, Stratification, and Political Economy.
All right, thank you. Some excellent presentations to follow. Clearly, this recession is a little more nuanced than what is typical. We dealt with employment, and we dealt with the loss of employment, but we also dealt with the vulnerability of employment. So that makes it somewhat nuanced. But you'll see that there's some things that aren't nuanced, that are common regardless of what type of business cycle we're in. So my task, as Jim pointed out, was to describe and talk about a racially inclusive economy. But before I get into it, let me preview some work that'll probably come out this month, or will come out this work. It'll be co-authored with Afranima Bial, Chris Famagetti, Avi Green, Kyle Strickland, and David Wilcox. We were tasked with talking about an equitable recovery and thinking about the role of race, labor markets, and education in particular. So we often know it's, I'm not telling anybody anything when I tell them that Blacks fare worse through business cycle. But it is commonly thought that it's because of where they're distributed along the skills dimension. But we get a paradox. If we look across business cycles, and this is work being led by Chris Famagetti, we find that amongst Blacks that are most educated, they have the greatest loss in equity relative to their white peers than every other educational group that we look at. And this occurs when we look at home ownership, when we look at wages, and when we look at employment. And if we do decompositions across those trajectories, we find that the component, not due to characteristics, but due to the returns on those characteristics, otherwise known as labor market discrimination or housing market discrimination, explain more of the component for those highly educated individuals. And we'll present this work, and then there's work led by Afranima Bial, where we look at essential work, not just it was the essential work as well as work that as we begin to relax social distance, work that exposes us to customer contact, we again will demonstrate the degree of overrepresentation, even when you look within bands of education. We do this work, we do that, Afronima leads that work looking at ethnicity, race, foreign-born status, as well as gender and their intersections, and we'll present all of that. All right, so what will be the state of the economy in 2021 and beyond? The answer is obviously gloomy, as if we don't implement an adequate public response to the inequality and despair that we're facing. We can say with certainty, based on recent history of economic downturns, as well as the economic structures that have been described, the aftermath of this pandemic will result in greater inequality and despair, particularly along racial lines. This past summer witnessed a wave of protests, if we think about political economy, in response to law enforcement and so-called vigilante racialized killings of Black people that we have not seen on scale since the civil rights era of the 1950s and 1960s, as well as the coronavirus pandemic, which has already triggered the loss of more than 350,000 American lives and more than 50 million Americans applying for unemployment at some point over the past summer. The paramount indicator of economic impact has to be, first and foremost, one's health. So we run the risk when we present a dichotomy between health and the economy. And if we look at racial differences in infection and mortality related to COVID, they're dramatic. The CDC reports that Black Americans have about a 2.8 times more likely COVID mortality rate compared to white Americans. With Black Americans making up about 13% of the US population and over 350,000 deaths to date, that would suggest that we've already lost in excess of 120,000 Black lives to COVID. That's a surplus of 80,000 lives, which would have been prevented had Black people had similar medical and political economy treatment as that of white people. And if we're conservative and say twice the rate, it would suggest 91,000 lives and 45.5 thousand surplus lives. Indeed, I wonder if the political response to the pandemic would be different if the face of that mortality were less Black. The pandemic reveals a collective public health and economic vulnerability, but also in plain sight, a peculiar racial vulnerability in which Blacks, again, are far more likely to die from the virus, and in which 45%, nearly half of Black-owned businesses, have already closed as a result of the pandemic. That the impact of something presumably random, however catastrophic, is so linked to one's racial identity, it's not only problematic, it's evidence that as a nation, our social safety net is failing. Unlike previous recessions, this recession is born out of a moral decision to cease economic activity in order to save lives. Paul Krugman called it, we hibernated the economy to save lives. Right now, we need to do everything to protect our public health and to keep workers, including gig workers, as well as micro businesses, and our aggregate demand in total as high as possible. People are talking about V-shaped recoveries, K-shaped recoveries. We know with the impending benefits cliff, once we relax evictions and foreclosures, it's going to be a straight old-fashioned downward cycle if we don't keep aggregate demand up. We need also to establish the building blocks for a transformative, secure, inclusive, and more equitable economy so that we will be less vulnerable to the next pandemic or the next climate-related catastrophe, as well as the everyday vulnerabilities in which many Americans still live. By April of last summer, last spring, our unemployment level reached 14.7%. That's as high as it's been since the Great Depression. The unemployment rate for Black Americans at the time was 16.7%, and 14.2% for white workers. Again, this recession is different. We hibernated the economy and there was mass unemployment. But we usually know that the Black rate is twice that of the white rate. So we had somewhat of an anomaly. But we also know that we have the typical adage that Blacks are the first fired and the last hired during economic downturns. But if we fast forward and look today, we see that the overall unemployment rate stands at 13.2%. The white rate is 5.9% as we've relaxed some of the social distance rules, but the Black rate is pretty much 10.3%. So although everyone was fired, it's still the case that Blacks are the last hired. The unemployment reports that I just described underestimate the economic toll. The toll of being out of labor force, the toll of loss of health insurance, as well as the mental and financial angst of unemployment and a pandemic more generally that's been taking its toll. It would be a lot less expensive and painful had we kept workers where they were with a paycheck guarantee. But reemployment of all these individuals is going to cause for something more dramatic, akin to what we did in the New Deal. And if you ask me, I'd say a federal job guarantee altogether. The best case scenario was for people to stay employed and to safely socially distant while not being at work and being exposed to the virus. Also, many Americans, Black and brown families in particular, have low wealth, inadequate health care, and work in these precarious but essential jobs that have few workplace protections, lower wages, and benefits. We need to understand that wealth impacts people's ability to respond to a pandemic, and it provides the economic security during an emergency. So if you did have a pre-existing condition, which by the way, isn't simply exogenous, it's related to political economy in the first place. If you did have a pre-existing condition, at least if you had wealth, you could make a decision and not expose yourself to mortality risk by going to work so that you can have subsistence. This crisis will only exacerbate our unjust racial wealth gap that leaves Black and Latinx and other low asset communities vulnerable. We know during economic downturns, when asset prices get low, it almost becomes a fire sale for those with capital to purchase those assets and then benefit from the appreciation when the economy turns around. The only way an increase in inequality does not occur is if this crisis spurs on a change in our political economy towards the implementation of a long-term structural policy change. A question for us is the vulnerability made so vivid by COVID-19, will it spur our political economy to an anti-racist, anti-sexist economic Bill of Rights frame where we end up with policy regimes that provide Americans with the essential resources so that they can have authentic agency and be their true selves? So here's some immediate issues associated with the pandemic. We know that jobs and worker benefit protections, that without the bold relief of a paycheck guarantee, that we had people that were vulnerable to unemployment or worse, or potentially worse, vulnerable to a deadly virus. We know that there was an inadequate health insurance structure prior to the pandemic, and it will become worse as we lay off many Americans. We know that wealth was inadequate for many Americans. We know that as a result of our banking system, particularly when we have federal legislation that distributes rescue checks via the banking system, that was not equitable in terms of who had access. We know that when we think about paycheck protection programs aimed at small businesses, if you were underbanked and didn't have a strong banking relationship or undercapitalized, you also did not have equitable access. There's no reason that we have to do all of this through the banking sector. We have a people's bank, the Federal Reserve, that could take a more proactive stance in making sure that there's greater fairness. If we think about our education system, we know that there was not equal access to broadband. Broadband should be a public good that should be federally financed and ensured that everybody has access. If this pandemic doesn't reveal it, it definitely, I don't know what will. We know that millennials who were saddled with student loan debt from the last Great Recession are going to face double economic scarring in the labor market. And not only that, record levels of student debt where we told them to wait out the recession and better themselves in universities while they were saddled with all that debt. And there are clear racial dimensions to that as well. We know that the average college graduate who's Black, 4 years after graduation, has an excess of about $50,000 in student debt. We also know that Black students are overrepresented in graduate school relative to their college graduate shares, and probably because they expect they're going to face a more detrimental discriminatory labor market, and they're pursuing a resume building strategy. All right, so how did we get here? We do not have an adequate social safety net in place. What we have is over 5 decades of deregulation, a market revolution that has been supported by a neoliberal vision of supply side economics under the lure that the structures and government subsidies that benefit corporate interests, the so-called job creators, would generate a market dynamism and economic activity that was supposed to lift all boats. That promise trickled down from that neo-supply side economic vision has never come to fruition. For the last 50 years, essentially all of America's gains from increasing productivity have gone to the elite and upper middle class, while real worker wages has pretty much flatlined. This is manifest in a concentration of wealth where the top 1/10% of earners, those earning above 1.5 million, have as much of the nation's wealth as the bottom 90%. What's more, one's race is a bigger predictor of wealth status than class itself. This obscene concentration, along with its plutocracy that is accompanying, it's not natural nor is it our destiny. Changes on the margin aren't going to cut it. To reverse decades and generations of poverty, discrimination, and economic and political concentration at the top, we need a bold overhaul of our laws and our economy. We're faced with a choice. We can continue down the path of deregulation and lower taxes for the wealthy, a gutting of government services and social welfare programs, or we can make a profound change towards more sustainable and moral economy with government interventions to facilitate the assets, economic security, engagement, human dignity, and social mobility for all its people, regardless of their race, class, gender, sexual identity, or immigrant status. We can say with certainty, if we don't act, this despair is going to increase. During the last Great Recession, we had a jobless recovery for a long time. Inequality grew. We had housing insecurity. We had evictions. We had foreclosures. And we had, again, a generation of millennials saddled with debt. By the way, for similarly aged millennials today, the racial wealth gap in home ownership is as large as it's ever been since we've been collecting home ownership data more widespread. So that's going to have implications on the racial wealth gap going forward. In addition, we were left vulnerable to a despotic strongman who was able to garner political leadership with divisive appeal towards codifying the privileges that go along with whiteness. Indeed, his signature legislation was a tax cut for the wealthy, but yet he was able to garner 70 million votes in the last election. A new industrial policy that centers workers, both domestically and abroad, coupled with an explicitly anti-racist and anti-sexist economic rights frame, would promote a fairer economy grounded in our shared prosperity. This is not unprecedented. Roosevelt knew that necessitous men and women were not free men. Roosevelt called for, in his 1944 State of the Union address, he called for an economic bill of rights. He called for, quote, physical security, economic security, social security, and moral security. This type of economic rights platform is well rooted in civil rights. The Reverend Dr. Martin Luther King wrote, quote, I am not convinced that the simplest approach will prove to be the most effective. The solution to poverty is to abolish it directly by a now and widely discussed measure, the guaranteed income. not UBI, guaranteed income. Dr. King's advocacy efforts of eradicating poverty culminated with the organization of the Poor People's Campaign. The campaign focused towards passing an economic rights with 5 tenets. 1, a meaningful job at a living wage as a right, a secure and adequate income for all, access to land, access to capital, and access to have a truly significant role in our government, basically civic engagement. Still, our contemporary political economy situates a proverbial market, which is a political construction, by the way, as a great, efficient, self-regulating, colorblind arbiter of all our worth and the solution for all our problems, economic or otherwise. But it's important to know that race provides the political fodder to promote that ideology. Race, along with government social programs, are scapegoated to fuel this neoliberal agenda. Poverty and inequality are attributed to deficiencies internal to the poor and Blacks themselves. Stigmatization based on race and anti-Blackness, they are strategically used to implement harsh and punitive control on the underclass. The framing is derived from a culture of poverty thesis in which Blacks are presumed to have an undervalued for and a low acquisition of education. The framing is wrong, the directional emphasis is wrong. It is more likely that meager economic circumstance, not poor decision-making or deficient knowledge, that constrains choice itself and leaves poor people with little to no other financial options but to obtain and use predatory and abusive financial services. We're not atomistic agents floating in unfettered markets guided by our free will into fair and efficient allocation. We need to do a better job as a profession understanding the roles of power and endowment in our political economy and be more focused on advocating structures that truly lead to more equitable and fair distribution. Power and capital do what they do best without government interventions. They iterate and concentrate. Authentic economic agency is grounded in resources. Inequality is not rooted in deficient people, but rather deficient resources, power, and capital, and sadly, the moral economic returns associated with one's group identity. We need to redefine our political economy and how we define economic good to embrace the principles of morality, humanity, and sustainability. The good news is change may be happening. As I mentioned in the beginning, we had a global movement with people shouting in unison that Black Lives Matter. We need policies with public options that directly compete with and crowd out inferior private options that do not ensure universal and quality healthcare, housing, schooling, financial services, capital, and the free mobility without the psychological and physical threat of detention or bodily harm because someone's identity is linked to a vulnerable or stigmatized group. What we do now is critical. We can redefine essential work and respect workers in general. We can recognize that inequality and despair are political choices, and they need not be our destiny. We can see that a federal government, for instance, with the IRS, can efficiently distribute money to address hardship on a widespread way to individuals and families. Government has tremendous capacity to create shared prosperity and to facilitate goods and services that are essential for the civic engagement, social equity, and economic inclusion for all. I know I'm running out of time, so I'm going to stop by just saying that we need to reject the empirically unsubstantiated rhetoric that ignorance and so-called grit and personal responsibility are the sources of inequality, along with the accompanying neoliberal paternalism in which our government attempts to coerce and incentivize insinuated defective people to behave accordingly and make better decisions. Instead, let's change the paradigm and institute initiatives that truly empower people with economic security, dignity, and authentic agency to define and achieve their goals. Thank you.
Thank you, Derek. That was great. So we have time for discussants, and I guess maybe it would make sense to go in the same order that we did the papers. So that would have Tom being the discussant for Giannis first, and then vice versa, and then Derek and I.
Alrighty, I'm ready if you all are. So, oh, I have to find my notes. Where'd they go? There they are. Okay, so about Jana's and et al.'s paper, it was really great to see attention to this particular aspect of economic disadvantage. And so I'm inspired to add a long overdue section to my course on intersecting inequalities that I'm teaching in the spring on this topic. So thank you for that kick in the pants, which I always need. So overall, I really like the paper. I had a couple of technical comments just about the regression results. So running Logit. This is kind of a pet peeve of mine. I always say, if you have a full model in mind, just run and report the full model. We all know there's omitted variable bias. So, you know, if industry and occupation matter, and I think they do, and if intersections matter, and they do, use those all in the model that you estimate. And so for me, in the table 4, that you have 3 different models with 2 different versions, I would say just the results for the 3rd model that incorporates the intersectional interactions, and columns 3 and 4 that include I think those are the ones that include industry and occupational controls. I think those are the ones that you should actually just report, right? That actually also is a statistical problem running several different models on a set of data. Like it increases the bar for statistical significance, which if you're interested in that sort of thing, I personally wouldn't focus too much on p-values. So, you know, in that table, you report that, you know, the estimate for Black men with a disability has a 95, you know, based on the standard errors that you report, has a 95% confidence interval from +3 to -40%. So yeah, I mean, there's a greater than 5% chance of a false positive, but that's not a meaningless result, right? Economic significance is still very much there. So this is my bias, right? In terms of doing and reporting econometric results. So talking about that, you report drops for Black women with and without and with a disability between January and April of 3.4 and 15.9%. It's a fascinating result, that huge gap there. And I would have liked to have seen a comparison to the actual drops for these women, right? So in table 2, you don't have those 3-way interactions. So it would be good to see them there instead of just the 2-way interactions that you report. And then you can directly compare your results with the raw changes and speculate about the difference and whatnot. So I think putting those 2 changes together could help you to focus the discussion more on that and ground it more in the intersectional analysis. In terms of the decomposition analysis, that's a great addition. I like that. And but I think you could elaborate more on how the tables were constructed a little bit. In the paper, there's just 3 paragraphs. You talked a little bit more about it in the presentation, which was good. But you know, less influence. I think less emphasis on, you know, models 1 and 2 and models without occupation and industry, and more on just that full model and the decomposition analysis, I think would be good. You mentioned somewhere that, you know, sample size could be an issue, but just kind of back of the envelope, I think you still have, even with you know, the 3-way interactions, there's still something like 800 or 900, for example, Black women with disabilities in the data set that you're running. So that's plenty, I think, especially if you're not too fixated on p-values and more about, you know, what the range of estimates are that you're looking at. So yeah, those were my ideas, and thanks for a great paper.
Thank you, Tom. Those are great comments. It is a brand new paper. We wrote it specifically for today. I'm glad it's finished. So you're the first person who has commented on it. So thank you very much. That's really helpful as we further shape and refine the paper and think about where to send it. As for your paper, which I've been charged with commenting on, I know that it's been accepted for publication, and I'll do a shout out for our special issue of Feminist Economics on COVID-19, which is coming out next month, or this month, I believe. So I'm not going to give suggestions on changing the paper because it is published. But I did want to emphasize what I thought was really positive about the paper and so important. And first, and that points to one of Jen's main points in her presentation too, is that you are making highly visible issues that otherwise would be invisible. You know, you are putting on the table and documenting and publishing on the experience of Black women during COVID-19 and just how much worse, you know, these employment drops were and why. And you're adding a theoretical perspective to why this is happening. And, you know, we need voices like that in economics journals, you know, to show otherwise their experience would be invisible to, say, policymakers or the scholarly eye. For people looking for, you know, substantiated statistics. And the study's so well done, and, you know, including the theoretical underpinnings that you added during the writing stage. I do have a question for you. I love how your presentation added the November data. And I know when you looked closely at the occupation and industry changes, you focus specifically on employment drops and the heavy representation of Black women as cashiers and as childcare workers. And I thought it was interesting once you added the November data, how between, I think you said it was February and November, I believe, that Black women's kind of bounce back was sort of in the middle of other demographic groups. And then when you look at the 2020 as a whole, overall, their job losses were still more severe than other groups. And I was wondering if you were able to dig into the November numbers and look at what's happening with cashiers and childcare workers. Are these two occupations that really helped with the bounce back or continued with the losses? So that's my question for you. What was happening between, I guess, April and November in terms of cashiers and childcare workers? And that's all I have.
Thank you. I can probably dig that up while Jen and Derek are just.
Who's going first, Jen?
You should go first.
Okay. So let me lead with accolades and actually end with accolades. I think this paper and your work in general exemplifies creative, thoughtful, rigorous scholarship that's not constrained by disciplinary boundaries to get at issues that are important, scholarly issues that are important for our social well-being. The choice of nurses to study becomes a really useful context, particularly if we want to understand the dynamics of gender, race, occupation, outcomes beyond just economic outcomes, including stress and mental well-being. And I know this relates to other work you're doing as well, where you can expand a great deal more on this in general. I'd say that an analysis across nation also gets at issues of power. So being able to compare and contrast the experiences of what takes place in South Africa and the US adds to this important issue. And then thinking about distribution of the vaccine and equity is also becomes useful. I think, and by the way, the disciplinary use, the thing I forgot to add as I ramble on is the value of qualitative work to support the quantitative information with the richness of qualitative work, where you go in and literally observe and ask questions of certain dynamics and nuance that we simply can't get with quantitative data points. So, I congratulate you on that. What was the other point? So lastly, thinking about the distribution of the vaccine and equity is also extremely useful. And I think the focus on people and where the risks are the most gets rid of a lot of the noise and nuance that becomes counterproductive. So I again applaud you for that direct use of focus on people and vulnerabilities if we're going to use equity as the frame by which the vaccine gets distributed. Ideally, I would hope it's universal, period, and obviously in an efficient short time so that no one has to go through that despair. Last thing I want to say is related not just to your work, but just to the endeavor of intersectionality. And this may get me in trouble, but I do want to point out that if we look at current unemployment numbers, in thinking about Black men versus women, the Black men unemployment rate today is 11.2%. The Black women rate is still atrocious at 9%. But the only reason I'm pointing this out is that just like the focus on nurses was your choice of finding a context for not just only scholarship reasons, but to also drive home some of the points you're making, when we think about intersectional analysis, I think it has to be context specific. It can't be thought of as simply one group has it worse or not worse in the absence of context, because we should also consider the fact that we have high spread of COVID-19 in prison populations, and we know that Black men are grossly overrepresented there. Clearly, if I were to do a study targeted on prison populations, the outcomes of intersectionality would be different than if we look at a different type of context. Nonetheless, we should do all of this and we should learn from it. But again, I add the cautionary tale that intersectionality is context specific. And then the other point is that it's difficult to divorce, and pun intended, men or women from their larger family context and thinking about intersectionality. So what happens to Black women affects Black men and vice versa.
Thank you for those. That's really helpful. I'm always excited listening to your visionary ideas, thinking about what we have to aim for. I'm especially interested in the ideas about changing political economy in the long term. And you talked about structural change and providing Americans with essential resources, which made me wonder a little bit about the ways that you're viewing something like a guaranteed income and a job guarantee now, if this is what kind of influence something like a pandemic has had on that, which presumably that is some. And then the other real question I've got is like, this is a really profound sort of political vision of policies to pursue. And I think a lot of times economists are still sitting here wondering like, what's the role of economics? What's the role of economists as a field in generating that kind of structural change to get to new industrial policy that's anti-racist and anti-sexist? And I guess from a more sort of applied perspective, I'm thinking about like, do economists need to acknowledge a normative position? Would that have any kind of weight in changing those things? And then the other, immediate thought was like, instead of looking at decision making, focusing on the structures under which people make decisions. And like you said, obviously the context always matters. And then I guess the last one was really about industrial policy. Because if we're going to have new anti-racist, anti-sexist industrial policies, it would be useful, historical examples, like what can we do to realize this, longer term change in the structural change in political economy. So basically, we just want to hear more. So I don't know if people want to respond, or we want to go to the Q&A.
I mean, unless someone else wants to go, I'll respond after. All right, so, quick responses. Social movements clearly have an impact. And, I'll take on the question of the role of economics. I think we need more integrity in our work. And by more integrity, I think we need to describe our values at the outset, to recognize that none of the endeavors that we do are strictly positivist, that we all begin with a normative perspective. The two welfare theorems of economics are normative perspectives. Whatever the normative perspective we have, I'm not even saying they're wrong or bad. I'm just saying lead with your normative perspective and your values. Otherwise, I think that we get interpreted as being scientific and fact-based to an exaggerated extent, not understanding that the ideology by which we begin to phrase questions and answer questions in and of themselves, just like the point of context that I led with earlier, the context that you study will generate certain outcomes in certain formulations. In other words, we have provided the fact-based cover for that neoliberal movement when in fact it's not really fact-based. So that's a problem. In terms of the industrial policy, this is work with Cassandra Lynn Robertson. Give ourselves a shout out. We have an essay in the American Prospect where we talk about how industrial policy, as well as trade policy, has focused myopically on the firm. And there's no reason that it shouldn't include labor and people. And in fact, if we had labor and people kind of akin to the New Deal in our industrial policy, as well as foreign policy, it would benefit workers more directly and promote shared prosperity, but also have some spillover effects for firms. If we had a care economy and firms had workers who were coming to work and not, or being at, the example you gave, a nurse and not having to work, be so concerned about childcare, they could be more productive and less stressed where they are. If firms didn't have on their ledgers the payment for health insurance, their bottom lines would even be better, and they'd be more competitive in a global space.
So I know we got two questions in the Q&A, one each, I think, for Tom and one each for Jana. So we could go to those. We could invite more questions from Q&A. If attendees have questions, why don't you write them in there? I'm not sure that we have another way to capture them. Or just identify yourself as having a question and we can turn on your volume so you can ask directly.
Maybe while
I need 2 more minutes to answer Jana's question.
Okay. Yeah, or I can also, since I jumped in, I can take Erica's question, and thank you, Erica, on the Q&A. You had asked about working remotely and how that's been changing during COVID-19. And there I would refer you to a piece that my co-authors just published in the Journal of Occupational Rehabilitation. It's actually cited in the paper that shows that people with disabilities normally are more likely to work from home, either exclusively or do some work from home. However, they are less likely to work in occupations in which people were working from home during the pandemic, which tends to be more white collar kind of jobs. So, the implication is that employers in, let's say, the service sector or other jobs where people with disabilities are heavily clustered, where they have not been working from home, need to think about more creative ways in which work from home can be happening. And you also asked about family structure. We don't have that information in the CPS. I think that kind of work would have to come from other data sets. But I think in general, looking at school closures and how that's impacted labor force participation, we have seen a bigger drop in labor force participation for women compared to men. And it's likely to be because more women are homeschooling kids. I haven't seen that breakdown yet for people with disabilities. So I believe that answered your question, Erica, and thank you. And I'll pass the baton to Tom.
Okay, I'm looking at those numbers, and I'll take Jana's question first. And the childcare workers for Black women, there were 292,000 in February, 238,000 employed in April, and 127,000 in November. So that's only continued to decline. In terms of cashiers, the employment went from 524,000 to 402,000 between February and April, and it's back up to 491,000 in November. So statistics at your fingertips as we go. And as far as Erica's question, thank you. Thank you for coming, Erica, and for your question. And as far as the ability to work from home, there's nothing really in the basic monthly survey there are no questions about, can you work from home? Do you work from home? That kind of thing. Although there might be a location variable. I didn't see it. But there are some studies that have looked at, and I referred to it when I was doing my presentation, that about 1/3 of workers could work from home, could potentially work from home. And those studies basically look at the occupations and basically go through each occupation and say, yeah, that can work from home, that can't, right? So, that's as good as it gets at the moment. And for most occupations, you can make a pretty good guess about what you can do from home and what you can't. Cashier, no. Banker, yes. So.
I actually have a comment and a question for you, Jen. I recently heard and was looking, there's a couple of websites where you can input some information about yourself and see your place in line for the COVID vaccine. So it's like a COVID vaccine place in line calculator. And I did it for myself. And as you said exactly in your presentation, and it's consistent with the guidelines, there are no questions about my gender or my race. So it's dictated entirely, by occupation and age. So when I did my place in line in New Jersey, I am behind 3.3 million other people who are at higher risk. And it gives a little chart, as to who is ahead of me, but it's these broad demographic groups. And I was wondering if you've looked at any of these calculators and if you think there is room in these algorithms, to add race and gender in order to get a better calculator. Do you think that that's something that's doable to get a hold of these algorithms?
I think that is absolutely doable and necessary. And I think that it's doable and necessary not just for general public getting access to vaccines, it's doable and necessary in healthcare spaces. I don't know if any of you read about the situation in Stanford, but their algorithm included the location of their desk. But residents and nurses often don't have desks. So, they have no value for that. Which is just the kind of thing that then ended up with residents not getting the vaccine, for one thing. and led to protests around it and led to them changing the algorithm. I actually am talking to another friend of mine who's been meeting with the county health department where he is based, who's also a sort of medical history person. And they're building a web portal for people to register for the vaccination and get a prioritization scale on age and health conditions, race, ethnicity, occupational exposure, institutional protection, and sort of living space. So whether they're in an institutional environment, long-term care home, whether they're incarcerated, those are all important variables. I mean, there is no reason that we could not be collecting that data and prioritizing on the basis of it. In terms of what we already have, you know, when you say that you filled in one of these things and it doesn't ask about race or gender, I mean, that should raise alarms. You know, I mean, like these are things that we know are fundamentally important, you know, and maybe occupation captures some of it, but the whole idea of using occupation as our entry into distributing the vaccine is also a really productivist, problematic way of dealing with that also, because those aren't the only people, you know, people who are working for pay aren't the only people who are at risk. You know, so I think there are lots of reasons to include a really wide range of factors, some based on things that we're already collecting data about, but others intuitively, we know population density, for example, increases likelihood of spread. So there are lots of ways that we could be capturing that and prioritizing better.
So, try to add a little bit to that conversation. This is not to disagree that we should pay attention to race and or gender, but it is to note that when thinking about contemporary phenomena, we need a historical lens as well, because there's quite a few people that will be distrustful of a vaccine that might target Black people just because of our history. That doesn't mean we shouldn't, but we certainly need to be cognizant of that history when thinking about campaigns and strategies to distribute an equitable vaccine. And then, you know, the other point I'll make is JT from our last session, and I'm sorry I'm mispronouncing her name, she made the point also that if we're thinking about our, what's the word? Why am I struggling with this word? Our patent laws, for example, and all the money that was put into vaccines and the fact that we are having issues of supply and distribution to begin with, I mean, that's something else we should think about, especially if we take it to a global context in terms of who's going to get the vaccine and when. Should it be a market-driven aspect to the extent that it is? Or should we have interventions that come in and make sure that it's mass-produced and it's more accessible in a more readily available way? And then I know the counter argument is would they have invested in building the vaccine to begin with, but we also know that there were huge subsidies on the front end as well.
Yeah, that's my first thought when you say to the market driven to the extent that it is that it already wasn't market driven from the beginning. And, you know, if we're gonna limit that as we should on the distribution side of it too, then, I mean, I feel like this is actually a real opportunity for us to be thinking about the kind of industrial policy that we talk about in South Africa that's part of state policy, right? And the kind of investment, the state investment in things like healthcare would be one way to do that. And I've talked before about nationalizing some of the hospitals that are closing because they're not doing elective surgeries and using those as training spaces for healthcare workers, which I think would be, you know, a good use of space that's closing down with those resources in them anyway. I see there's another question in here. Oh God, it's for me.
I guess we should read it out, sir, because I'm not sure the audience sees it.
Oh, You make excellent points about the necessity of targeting those most at risk. Occupation by gender, race data within the direct care healthcare workforce could provide the evidence that complements your presentation. Yeah, I mean, the concentration, there's an institution called PHI that focuses on direct care and has lots and lots of data. I only wish that policy recommendations took these demographic characteristics into consideration. However, as you know, there is no public recognition that the #1 direct healthcare workforce is both gendered and the specific racial, ethnic, and nativity groups are the workers most at risk. Yeah, I mean, and they're often excluded from healthcare policy because a lot of them are home health workers and some of them are counted as like personal care aides. And I haven't finished doing my research on this, but there is some history of this where home health aides didn't count as workers, weren't considered workers in the Federal Labor Standards Act until relatively recently.
Were they considered domestic workers? Is that the categorization, or?
Like I said, I haven't gone through it. They weren't subject to the same kinds of protection that other workers were, which goes back to the feminist economics whole focus on what counts as work and what's not, and what kinds of work are valued and what kinds aren't.
And the racist implementation of the Wagner Act to begin with, which excluded domestic and agricultural workers, right, who were 90% Black women and 50% Black men, over half Black men.
Personal carriers are now formally considered as healthcare support workers as of 2018.
I think it's important to note that a lot of, I think something like 1/3 of domestic workers in the US are immigrants of some kind, and many were in legal limbo. So there's another level of intersectionality with national origin. I think, Jen, you mentioned that in your presentation also. And people were also, in legal limbo with travel bans and not being able to go home, not being eligible for supports in the federal or in states relief for COVID-19. So this additional dimension by national origins and countries of citizenship was especially important and potentially harmful for domestic workers.
That's a good point.
Yeah.
Thank you, Janice, for that question. That's really helpful.
Derek, what were you going to say?
Oh, I was going to give a shout out to David Wilcox on when we did that work. He especially singled out that we should look at agricultural work, particularly in the Midwest, and look at it by foreign-born status, because we know that was a place of high rates of infection and mortality, and obviously not the most pleasant work to do. And that was an industry that bared out what you raised, Yana, in terms of foreign-born status. We're particularly vulnerable in that industry and sector.
So we only have 2 minutes left. I'm tempted to give you an example on the foreign-born angle that I was thinking about of how these power relations. If there's no other questions, I might just as like a 30-second almost thought experiment about if we take an occupational perspective within sectors and we're just looking at essential workers overall, we have a possibility in phase 1B that you would have someone who is an immigrant worker or an undocumented worker who is getting priority over, for example, a white police officer. And the power relation between these groups, I mean, that would be a significant reversal of that. And that is, I think, a much more sort of confrontational inversion of the power relation than what we're proposing for the healthcare example. But I think that's one of the reasons that the inversion is sort of interesting, that it could be really powerful. So it looks like we have 1 minute left, and I think we're going to get kicked out. Tom, are you going to say something?
Just thanks for the great panel, everybody.
Thanks
For everybody for coming. Thanks,
Yeah.
Nina, for the shout out on Twitter.
Thank you all for being here. Thank you, panelists. Thank you for attending, everybody else. Look forward to seeing you all in real life soon.
Soon. Bye-bye.
Bye.
Bye. Thank you.